नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर ज्वाइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज लाइव सेशन. eGlobal Doctors, digital health hospital connecting patients across the globe to doctors all over the world. In today's session, we will be exploring and providing more information about cancer treatment in conversation with Dr. Dodul. First question, what are some new cancer treatment that have emerged in recent years and how do they work?
Cancer treatment has different parts, or you can say that we divide into surgical treatment, systemic treatment, and radiation treatment. So these are three main pillars of cancer treatment. And we have been witnessing spectacular advancements in each and every field. Like nowadays, we talk about robotic surgery in cancer care. And then a little bit of specific things like in breast cancer, we talk about sentinel lymph node biopsy. We talk about avoiding full-fledged axillary dissection for lymph nodes. We talk about different types of newer approaches to breast reconstruction. And then in systemic treatment, we talk about categorizing the patient, whether they need chemotherapy or whether they can be they can omit chemotherapy safely and continue with some other medicines without giving significant side effects. Then we also talk about newer developments in radiation, like the particle beam therapy, like carbon ion therapy, like proton beam therapy. So we also talk about more focused and precise radiation, like stereotactic radiation, ablative radiation. So these are definitely some kind of new things, which I'd say is not exactly very new, but yes, it's gradually being adopted in day-to-day clinical practice in a significantly large number of countries gradually.
So what are some targeted like therapies different from traditional cancer treatment and how can they improve the outcome?
Yeah, again, a very interesting question. Like traditionally, when you talk about cancer care or systemic treatment, so by saying systemic treatment, we mean to say a treatment or a medicine which can reach the entire body. So when a medicine reaches the entire body, of course, other than killing the cancer cells, it shows its effects on the normal and healthy cells of the body as well. So the kind of toxicity we experience with such conventional approaches with chemotherapy, quite some time it becomes significant and the patient develops a lot of problems in their daily life. And that can include like drop in blood count, nausea, vomiting, hair loss, change of skin color, loss of taste, and many others. So scientists have been working relentlessly on these things, and they have definitely been able to devise new treatments, which they have given a interesting name like targeted therapy.
Can cancer have a personalized medicine? Like, how does it allow doctors to tailor a treatment for individual cancer patients?
Yeah, it's a very, again, a very interesting question. I mean, the personalized medicine is not only about cancer, I would say that way, that a personalized medicine, which is also known as, you can tell it like precision medicine, personalized medicine. So it's basically it's a model. It's a model which differentiates different people, so one from another, and customize the need for that particular patient. So it's not a generalized approach we earlier used to have. Like when we decided about chemotherapy, the factors which we usually take into account are like what is the tumor size, what is the stage, what is the age of the patient, whether the patient is in a fit condition to tolerate chemotherapy or not. So like that. Now from that, we have gradually been moving to a customized, tailored approach. And that includes detailed analysis of the tumor itself.
So the question is, can a proper balanced diet control the cancer? Can intake of proper water also help?
So a balanced diet and taking proper amount of water is absolutely needed, no matter whether it prevents cancer or not. There are a lot of hue and cry about diet and cancers, but I must share that there are a lot of studies have been published with contradictory results on diet. So I remember sharing this thing in the first session also, that it's not actually the diet per se, but most of the time it's the chemical substances used to prepare that diet or food or to preserve them, which is the main culprit, right? Like I was talking about some dry meat preparations in some other program, which uses a lot of chemicals. Like we are aware about a lot of noodles where some specific ingredients are being used for making them more tasty. So those chemicals are actually the main culprit rather than the diet itself. Now, there are a lot of concerns about eating non-vegetarian food causing cancers. There are a lot of discussions like probably a vegetarian food is the solution to prevent cancer. I would say that these things are definitely good for making a healthy lifestyle, but cannot say that reducing non-vegetarian food in your diet is the absolute or the only key to prevent cancers. So the results are contradictory. The information, most of the time, you cannot be able to make a study where you will have millions of people where everything is same and only the diet is different.
What are some immunotherapy for cancer, and how do they harness the immune system to fight cancer cells?
Wow. So again, a fantastic question. So immunotherapy or immuno-oncology, it has been I would say, like limelight since last almost 1 decade. It's not something very new, I would say. Like the concept of immunotherapy has been there since like 1970s. So it's a concept which is almost more than 5 decades old. But the clinical application of that knowledge is gradually becoming more and more common over the last 1 decade. So there is some, so people believe that immunotherapy actually boosts the immune system. So I would say it's not actually the boosting of immunotherapy, the immune system. What these drugs cause is stimulating our own immune system. So it's not boosting. I would say it's not boosting, it's actually stimulating the immune system so that our own existing immune mechanism can fight against the cancer cells. Now, technically and scientifically speaking, this depends on some receptors and molecules. Like when a foreign body enters our foreign body, like some virus or some bacteria enters our body, our immune system identifies them and kills those things. There are some receptors, we call them programmed cell death receptor or programmed cell death antigen. So these two things are present in two different places. One is the host, like the human being. The other in the foreign object, or you can say the cancer cells. Of course, the cancer cells, they grow inside our own body, but the body considers them as foreign object, right? Now, the programmed cell death receptor is, or the programmed cell death antigen, PD-1, they are present in our host T cell. The T cell is our main cells in the body which fight against cancer cells or foreign objects. And the ligand is present in the foreign, either the foreign object or the cancer cells. Now, when they attach to each other, there is a mechanism by attaching one to the other one that causes down regulation of the immune system so that the body's immune system do not destroy the surrounding normal cells. So for example, a virus entered our body and the immune system is fighting against the virus. So at the same time, the immune system can also destroy the surrounding normal cells. So this is a body's protective mechanism to downregulate the immune system.
And we have been talking about, how intelligent our human body is and how intelligent the new medication is, that it's targeting only to the cells which are bad or foreign to our body and protecting our own internal molecules. So I'm going to talk about artificial intelligence. So how is artificial intelligence being used in cancer research and treatment? And can it actually predict or identify the outcome of the new drugs that, the targeted drugs that you were talking about?
So again, a very nice question, and it's a thought-provoking thing. We nowadays are discussing a lot about this artificial intelligence or AI. It's an evolving science. It's an evolving science, I would say, and most of the things are under other research or clinical trials. So artificial intelligence is a very complex thing, and it has many aspects. It's not something which is a one-word solution or one-word discussion. So the name artificial intelligence itself signifies that it is something which is artificial in nature. So it's like you can say human brain, human analytical power, and just machine form of that human intelligence, you can say. Now, basically, so these are all either softwares or machines which have sufficient data fed into them. So to have artificial intelligence into work, you need to have data. We call them like big data, where we have the information about, say, for example, thousands of patients, about their demography, their age, their performance status, their tumor nature. And the software are being developed to analyze them. So we have already known outcome in a large number of population. Those data are being fed into the software, being analyzed, and then a model is being created so that when in future you are putting a particular new patient's data into that model, you are coming to know about what is going to happen for particularly that patient. So it's kind of comparison between the existing information and new data being fed into the system to know how this patient is going to differ from the existing outcome when you are utilizing some specific treatment. Rather than the treatment part, actually, the AI is much more established in today's time in diagnostics or cancer screening. So probably you have heard about Google DeepMind. So that's a tool to screen breast cancer patients. So to reach that point, they had to feed like thousands of patients' data into the software to analyze the image character. And then it was found subsequently that that particular software can predict or analyze a mammogram, which is like a soft X-ray of the breast, and give more accurate prediction or diagnosis or information compared to a human being, compared to a conventionally trained radiologist. So trained radiologist who was working specifically on that breast cancer screening, his report was compared to this AI-based report, and it was found that this AI-based report is much, much more accurate than human report. So that is how AI is becoming more and more important. Now, that's not the end. We are now having machines for treatment also. We are now having different other diagnostic approaches where this AI concept is being utilized. And very recently, one study was done in US, where they have utilized one concept of this AI, like natural language processing, NLP.
It is actually very interesting. And I love the fact that you mentioned a historic data is actually used to predict. But that's not the end. Of course, you are the subject matter expert, but then we also have the historic data to compare what are the chances of risk factors. What is CAR T cell therapy and how it can be used to treat certain types of cancer?
Yeah, it's a very new thing and it's an upcoming thing. So CAR, basically it's a CAR, which means chimeric antigen receptors. So you can say this CAR T cells. So I was telling you that T cells is the T cell is one component of our immune system, which takes a major role in killing cancer cells. Now, what scientists are now doing, they're engineering these T cells to give them an ability which will enable them identifying the cancer cells specifically. So to do that, they take the blood from either the patient himself or herself, or they can take the blood from a normal population. So when they take this blood from the patient, particularly or the patient's own blood, it's known as autologous. And when they do it from the common pool or the patients, then it's like heterologous, you can say. So what they are doing after taking this blood, they are separating out the T cells and engineering them. So in basic mechanism, this autologous or this allogenic or heterologous, you can say, they're mostly same, only the source of blood is different. So after separating out the T cells, they're modifying it. Now, most of the time, so as of now, a lot of trials are going on. These engineered T cells have the specific capability of identifying cancer cells. And then once they find the cancer cells, they attach themselves with this, and gradually a cascade of reactions start inside the cancer cells, leading to death of the cancer cells. A lot of studies are going on, and as of now, most of the utilization of CAR T cells are related to blood cancers. So hopefully it will definitely come in a bigger way in many other cancers as well. It's quite interesting thing.
It is quite interesting. Like I said, this was something that, recently started surfacing. So you talked about patients and their families. So I'm going to ask you a question, that what is the role of patient advocacy in advancing the cancer treatment, and how patient and their families get involved in the research process?
Wow, very good question. So patient advocacy stems out from the word patient advocate. So now we need to know who is a patient advocate. So it's just like advocate for many other purposes. There will be people or person who will understand a particular patient's perspective and put it forward. Now put it forward where? Like in a court of law, we know that the advocate puts it forward in front of the judges or other persons.
So I do have a follow-up question. So it's good to have someone who is advocating and telling us, keeping us on track. But are the advocates also medical people, or they are specialists trained in certain areas?
So and there is no excluding factor, or there is nothing like a medical practitioner or doctor cannot be part of the patient advocacy program. But most of the time they are like from a different field, from a different specialty. So they would not have this kind of bias. So most of the time they will be from a different specialties. So the medical bias will not be there, and they will be having kind of a perspective like a common man or common human being.
Okay, that is where I was going. So thank you for clarifying that. So it's a third party, nothing related to the medicine or to the patient, and they are here to provide an honest opinion. Thank you for that. I do have a question that I see on our live. So the question is, what can I do to manage the potential side effect of cancer treatments?
That's a burning question, which almost every cancer patients or survivors have in their mind. To begin with this question, I would say that side effects of cancer treatment, they are definitely decided by kind of medicines or kind of treatments being offered. But at the same time, it also depends on who is the treating physician. So making a right treatment decision, deciding a right molecule, then if it is surgery or radiation, then doing the surgery or radiation in a proper way. So all these things ultimately decide about the grade of side effects or the amount of side effects one is going to have. Say, for example, a patient reaches Dr. X. Dr. X decides about a chemotherapy for a breast cancer patient. Again, I'm giving this example for an early breast cancer patient in a, so for example, a 60-year-old lady who has a very small tumor, so for a 1 centimeter tumor. So traditionally, we'll be treating that patient with a chemotherapy. And of course, we know that chemotherapies, these type of chemotherapies, they can have significant side effects. Now, the same patient went to have a second opinion to Dr. Y, and Dr. Y advised him an Oncotype DX risk scoring criteria and found that the risk score is 8. And Dr. Y suggested that you do not need any chemotherapy and just having a hormonal pill like tamoxifen or some anastrozole or letrozole is sufficient for you. So pop a pill every night or every day. And of course, the side effects will be much, much less. So it's a hormone receptor positive tumor. You are 60-year-old, you have a small tumor, there is no glands, no other risk factors. So of course, then the side effects are becoming different.
Okay, thank you for that clarity. So hopefully whoever asked the question actually got the answer. And like doctor mentioned, there are a lot of tests that they run. So if your immunity or if your score is lower of not getting cancer again and again, then chemo is not the option. They'll give you something which is related to hormonal. So please make sure you do visit the subject matter expert. We were talking about vaccines and treatment. So let me talk about what are some promising new cancer vaccines which are currently under development and how do they work?
So again, a very interesting question. I remember in the last session also, I have briefly mentioned about this vaccine. So vaccine traditionally means something which prevents us from developing a disease in future. Like there are a lot of vaccines against some infections. So, you know, like once that vaccine is taken, the future risk of developing that infection is very, very less. Like tetanus, like diphtheria. So most of these infections are nowadays having a lot of vaccines available. Like measles, you know. So all these are, there are some vaccines which once given gives a long-term immunity and the person may be safeguarded from having that infection. So this concept was not quite common for cancer. But then the researchers found out that there are some cancers where the agent causing the cancer was some kind of infection. The commonest example was cervical cancer in women, which was a leading cancer in women once upon a time before the breast cancer took the first place. It was found that human papillomavirus, it's a virus which is mostly sexually transmitted or it's transmitted because of poor hygiene of the genital area. It was found that this human papillomavirus is responsible for almost 95% cases of cervical cancer.
That's actually wonderful to know. Like I said, there is always a light at the end of the tunnel. So it's really good to know that it's curable and it's treatable. So don't get scared. So if you are joining us, we are actually talking to Dr. Dodul about cancer treatment. A new feature that was added is prescription shipping services. It's only for Georgia State, but at the rate that eGlobalDoctors are going, You never know, next time we come live, we will have another different states for you. So eGlobalDoctors have partners with Sugar Pharmacy to deliver medicines to the people of Metro Atlanta local community. For more information, you all know what you have to do. Visit eGlobalDoctors.com. I'm going to be asking Doctor for you, if you don't mind, and if you can summarize the session, cancer treatment session for us.
Wow, I would like to do that. So it was very interesting discussion, and the questions were really thought-provoking. And in this discussion today, we kind of discussed about what are the newer approaches to cancer treatment, what is immunotherapy, what is targeted therapy, how this patient advocacy program or patient advocates are going to benefit the patient in terms of outcome and cancer research. We have also discussed kind of on artificial intelligence, and we at the end we discussed about the cancer vaccines. So quite an interesting discussion in last almost 1 hour, and I really enjoyed it.
Likewise, the feelings are mutual. We always learn a lot when you are with us. So it's a wrap.
Thanks a lot for that.
Thank you. And it's a wrap. eGlobalDoctors is one complete healthcare platform solution for all your medical related issues and questions. And maze ki baat hai, all these services are available to you at your fingertips. Smartphone uthaiye, or without breaking your bank, take the consultations that you have been waiting for. So before I let you go, Dr. Dodul, any word of wisdom that you would want to share with our viewers?
Always, I'd like to do that. And I always like to share my thoughts about this entire cancer thing, cancer care, patients' concerns. So, and I always say that it's a suspicious mind which diagnoses cancer at an earlier stage. So be suspicious. Don't let go your symptoms without being evaluated. Take opinion from a qualified cancer specialist and treat yourself at the earliest possible time once you are diagnosed with your cancer. And with evolving sciences and evolving newer treatments, it's not all about darkness. There are a lot of hopes and hypes, and we really look forward to have even better outcome in coming days with all the newer treatments, newer molecules, newer radiation techniques, newer surgical approaches, and of course, support programs from different support groups.
Thank you for that wealth of information. Please don't be a doctor yourself. We have subject matter experts like Dr. Dodul. If anything out of ordinary that you see, then make sure that you go and visit the specialist. So, well, there you have it. With this is RJ Kunjan signing off. Sayonara. Stay tuned till we meet again. Keep smiling always. Namaskar.
Namaskar.